ask workers about their low back pain, and if you ask them if it's caused by the work factors, many of them state that it's the case. About 23% state that it's primarily the cause of the work factors, and another about 30% say that it's partly caused by work factors. But of course, to state if something is an occupational disease, that's a rather firm statement, and it has consequences for the employer. So you have to have more evidence for that than what the patient thinks about the complaints. So the problem is that we have no clear assessment tool to support the recognition of low back pain as an occupational disease. And that's why we started in 2003 to develop a practical tool with which you can assess the work-relatedness of low back pain, and can make an evidence-based estimation of the risk that the work-related factors indeed are causing the low back pain in that patient. And I will give you a short overview, because this has already been published, of how the instrument works, and then go to what we found then about the incidence of low back pain as that you can evaluate as being an occupational disease. For this practical tool, we did a systematic literature looking at all the literature that have had quantitative data about the relationship between work-related factors and low back pain, and they were put into a decision model. Then we used this decision model to develop this practical tool. And we had several national expert meetings to look at the applicability of this tool, because you can have maybe a very complicated tool, but when it's not used in practice, there's no use for that. And we also had an international meeting when we had a further developed concept of this tool ready to look at the acceptability of this tool internationally. Because this applicability is very important. And here you see a picture of the international group that was in the Netherlands in Amsterdam in 2003 to look at all the aspects of this new tool. And we had a paper about this workshop we had published in the Scandinavian Journal of Work, Environment and Health. And in a very short summary, what this decision model does is make a sort of risk assessment where you say, well, you have a priori probability of workers and non-workers of developing low back pain. Everyone has it in the population, and we know that the risk of developing low back pain is going up with age. So this is a sort of background risk everyone has, and in this risk all kinds of risk factors are incorporated. In this model, you can add to this a priori probability a work-related risk factor, but especially you can also add another work-related risk factor, and you can have in this decision model estimations of this risk from various studies in one decision model. So you can add up the different risks. And this model has also, this decision model has also been published in Scandinavian Journal of Work, Environment and Health. So this gives you the probability of the low back pain due to work-related factors. So, and just to give you a short overview of what we found in the literature, I hope we can see it. Well, I hope you can see the green, yellow-green figures. But here you see the risk estimates, the pooled odds ratios for the various risk factors that we found. Manual materials handling, frequent bending and twisting of the trunk, and whole body vibrations are very well-known risk factors, work-related risk factors for the development of low back pain, and high physical workload. For all the and for psychosocial risk factors, we found monotonous work and job dissatisfaction as risk factors. All the other work-related risk factors didn't have, when you look at them in the model and you look at the pooled odds ratios, they didn't have significant increased risk for developing low back pain. What we did find, however, is that in some studies you have also different thresholds for the risks. And we also put that in the model. So for some risk factors, we could also look at high exposure risk and see what that adds to these odds ratios. So you see that here. But if you look at the numbers, they are rather small, and that's why it may be so difficult to identify which work-related risk factors are important in the development of low back pain and when low back pain is an occupational disease. Because each one of them may be not enough to establish a firm relationship with the work factors. But if in this decision model you have the opportunity to add them up and to put this in a practical tool, then you can maybe say, well, this work situation has manual materials handling as well as frequent bending and twisting of the trunk, and together they have such a workload that they can you can assume they contribute to this development of low back pain. So here you see the tool that we developed from the decision model, and here you see the statements about manual materials handling, frequent bending and twisting of the trunk and whole body vibration, and for each one we could make a statement at a different threshold level, a lower threshold level and a higher threshold level. I won't go through them all. You can also, if you want to read it in the publication that we made. But the decision model yields a score for every when an employee has a certain level of workload, you can derive a score for it. So, for instance, this worker, it's just an example, he has the highest level of risk for manual materials handling, and then in the model he gets a score of 7. The score of 7 is just derived from the statistical analysis. So if this employee also has frequent bending and twisting of the trunk at a lower threshold level, a score of 5 is added. So, and if he doesn't have a whole body vibration, then the total score is 12. That's just an example. And then these scores go into a sort of a scheme where you can read the probability that in this employee the low back pain is caused by the risk factors that you have assessed and that are in this model. So you saw from the previous slide that the score was 12, and you see if this employee is under age of 35, the probability that his low back pain was caused by the work-related factors is 55%. You see that in older age groups this probability goes down, and that's because a priori probability is higher. So it's more difficult to establish the additional effect of these work-related factors in the development of low back pain. So in general, in older employees, it's harder to establish the relationship between work-related factors and the low back pain. So now you can use the outcome of this practical tool in the case management of employees with low back pain. But also the question is it an occupational disease? Because that has further consequences for the employer and for adaptations that you have to do in the workplace. We wrote a criteria document about this whole instrument, and you can find it when you have the presentation. You can find it at this link, and you can download the whole document. It's in English also. So then in the Netherlands, we had this, of course, we had this instrument, and we wanted to incorporate this instrument in the notification system for occupational diseases. In the Netherlands, every occupational physician is obliged to register an occupational disease when he encounters it in an employee. Of course, implementation and compliance to that rule is always a problem, but it's an obligation by law to the occupational physicians. And we want to incorporate this instrument in a guideline for this occupational physician so that we can look at the National Registry of Occupational Diseases if it had an effect on the incidence of low back pain. And that's the main thing I wanted to tell you about today. So the instrument was incorporated in a guideline for the occupational physicians, and it was introduced here at the very beginning, January of 2005, and immediately you can see that the numbers of non-specific low back pain that were registered as an occupational disease went up very quickly. You see that the specific low back disorders, well, they rose a little bit, but not very much. So they stayed more or less the same. So and the instrument is especially developed for non-specific low back pain. So this is what you would expect. Within this national registry of occupational diseases, a prospective cohort study was developed, a 5-year prospective cohort study of which we could obtain data from the first 3 years. And in this cohort study, about 180 occupational physicians participated. It's about 9% of all occupational physicians in the Netherlands. And we had, in these 3 years, over 1.5 million worker years in this database. You could see that in this period, about 40% of all notifications of occupational diseases due to low back pain came from this cohort population. So within this total registry, there was a small part, and it was developed as this prospective cohort studies. In this prospective cohort studies, these occupational physicians were especially trained and stimulated to report these occupational diseases if they encountered. Not only low back pain, but all occupational diseases that they saw. So there was a higher compliance to the registration of occupational diseases. And from this cohort, we estimated the incidence of low back pain registered as occupational disease. And we could calculate that the overall mean incidence rate was 19 in 100,000 worker years for non-specific low back pain and 5 for specific low back pain. So these are just figures. Maybe they don't mean very much to you, but I will translate it in my last slide to what it means in practice. A strange finding was that 91% of the notifications were in male workers, so only a very small proportion was in female workers. And you can't, and for instance, also among nurses, etc., the incidence of notifications for occupational disease due to low back pain was very low. So there's a sort of limitation for occupational physicians to report occupational diseases in women, and we don't know especially why, so we have to look further into that. So they mainly report male workers, occupational diseases in male workers. It's not just only for low back pain, it's for all occupational diseases. You see that the incidence raises with age, as you would expect, and you see that in some branches, such as construction and transport and storage, the incidence is much higher than the overall incidence rate. So I will skip this one, and I will look at some part for the discussion. Well, of course, the implementation of this obligation to register all occupational diseases is not 100%, is not completed yet, but in this prospective cohort study, they were stimulated to do so, so you can expect that the incidence rate goes up to the real incidence rate that you would find in a workers' population. Well, I already stated the underreporting in female workers, and we also noticed that there was not an equal distribution of notification over the various economic sectors that you would not expect to be a consequence of the workload in this economic sector per se, but there are also some biases that in some sectors occupational physicians report less occupational diseases than in others. For instance, in construction work, it is known that they have a very high compliance rate to registering occupational diseases. So we published this already, this work in the European Journal of Pain in 2013. So I think with this instrument we can have a closer look at the incidence of occupational diseases. I see that one slide that I just took the wrong presentation from my disk, because I had one slide to tell you what it means, these numbers, these incidence rates for employees that develop low back pain. So how many of the employees that develop low back pain have through this instrument an occupational disease, are registered with an occupational disease, and that's about 1 in every 1,000 to 1,500 employees. So you see that with this instrument and the very strict rules that are applied to it, only a very small number of employees can be evaluated as having an occupational disease, but still it's very important because you have high numbers of employees with low back pain. So in these cases, employers are obliged to do something about the situation. And also you can see, of course, that if employees have a little bit less probability, not over 50%, but maybe between 40 and 50%, you can also stress the employer that he should do something about the economic situation of this employee. Thank you very much.
Any quick questions?
Thank you for your good presentation. I noticed in my office that some patient workers will report to me that the back pain were coming from their condition of work. And it was more than the number that you told me. So the beliefs from the patients and the reality are two things, and that's good that you have such a tool to classify better the low back pain. Yes.
I think that is very important because when disease is notified as an occupational disease, it has high consequences for the employer, for the legal system, for claims.
Correct.
So you have to have an evidence-based statement about.
You're true, because otherwise it is only a wisdom. The patient believes, and he comforts in his position. And at the same time, even if he's suffering, but he complains, he's staying in his. He has some center of attention around him, and that makes him feeling good in such a.
What we stress in the publication also is that the threshold should be registered also with objective measures. So you have to have some investigation of the workplace to look at this threshold in a certain employee.
Thank you.
Okay.